Good afternoon. I'm going to call this meeting to order of the Assembly Committee on Health and Human Services. Madam Secretary, will you please call the roll?
Assemblywoman Benitez Thompson. Assemblywoman Black.
Here.
Assemblywoman Garlow.
Here.
Assemblyman Hafen.
Here.
Assemblywoman Krasner.
Here.
Assemblyman Matthews.
Here.
Assemblyman Orenlicker.
Here.
Assemblywoman Peters.
Here.
Assemblywoman Summers Armstrong.
Here.
Assemblywoman Thomas.
Here.
Assemblywoman Titus.
Here.
Chair Nguyen.
Here. We have everyone present except Assemblywoman Benitez Thompson. Please mark her absent excused. If she does able to get on, if we could just mark her present when she arrives. She said she was running a little late. So I just want to welcome our audience to joining us on this virtual meeting here today. Today we have a presentation on the Patient Protection Commission and one bill hearing on Assembly Bill 16. I'm just going to jump into it. Agenda items may be taken in a different order. Today they are going to be listed in the order as listed on the agenda. First we'll have the presentation and then we will have the Assembly Bill hearing. This is a virtual meeting format. Members of the public may provide testimony in various ways. They are listed on the agenda. You can either participate online, via telephone, and you can obtain all of that information on our website, the Nevada Legislative Information website, NELIS, or you can watch us on YouTube. The chair or the member of the committee may request testifiers submit documentation supporting their testimony, and we will get that up online if it isn't already or as soon as we can. If you do submit public comment, you must do so within 48 hours of the meeting adjournment for it to be included as a part of today's record. And finally, if you are on the Zoom call, if you are not speaking, if you can remember to mute and unmute when you speak and identify yourself when you do speak as well. And with that, we'll move on to our first agenda item. Today, we're going to start off with an overview of the Patient Protection Commission. We will be likely having some bills. Most of the bills that came out of this Patient Protection Commission have originated on the Senate side. And, if all goes well over there, we will see them at some point on this side. But I know a lot of people have been, inquiring about the Patient Protection Commission. So I would welcome our first presenter here today, the Executive Director of that Commission. So please introduce yourself for the record and begin when you're ready.
First, thank you so much, Chair Nguyen. I think I'm sharing my screen. If we can just verify on your end that you can see my screen.
I can see it. Broadcast services, can we confirm that the public can see it as well?
Yes, Madam Chair, we can see the screen.
Perfect. Go ahead.
Okay, wonderful. Thank you so much, Chair Nguyen, members of the committee. My name is Sarah Shulhagian. I serve as the Executive Director for Nevada's Patient Protection Commission. I first want to thank Chair Nguyen for giving me the opportunity to come in front of you all to give you an overview of the commission, to kind of highlight some of our responsibilities, share some of the future work that the commission has done, and then really touch upon some of the proposed legislation that she just briefly mentioned. With that, I think what I'd like to do is just start with a little bit of an overview of the commission. So this commission was created through the passage of Senate Bill 544 from last legislative session. It was a measure that was sponsored by Governor Sisolak and received bipartisan support, ultimately passing unanimously by both houses. We are located within the governor's office, and we're dedicated to we're dedicated to improving healthcare in Nevada through a systematic, comprehensive review of the state's healthcare system and challenges and initiatives surrounding the quality, accessibility, affordability, and healthcare in our state. The commission is also charged with making informed recommendations both to the legislature and to the governor to improve healthcare for all patients. Taking for a moment to just share kind of the mission, vision, and values of this commission through the lens of our governor. He saw this as a way to provide a forum for all stakeholders to come to the table, work together on the critical task of improving healthcare access and affordability in Nevada for every patient. Our commission is comprised, our team is myself as the executive director, and we have Ms. Leslie Mayville, who serves as the administrative assistant and policy coordinator, and I currently have a vacant position, staff position, that I hope to fulfill later this year. But Chair, I would be remiss if I didn't just pause for a moment to thank the other state agencies that were monumental in helping me get this commission up and running relatively quickly last year. I would not have been able to do this in the timing that we were able to host our first meeting had it not been for the assistance of Commissioner Barbara Richardson, Executive Director Corbulic, and Director Richard Whitley, who provided dedicated staff and additional resources to help facilitate me kind of putting it all together and and getting this up and running. So I just wanted to take a moment to really thank them because they were monumental in getting us established. The commission is comprised of 11 members who have been appointed by our governor, and they really represent a lot of experience across the healthcare spectrum. Our chair is Dr. Ikram Khan, and the commission also has, they all serve in a voting capacity, and we also have 3 non-voting members, which are Director Richard Whitley, Insurance Commissioner Barbara Richardson, and the Executive Director of our exchange. What I'd like to do now is just kind of highlight some of the commission activities that we have from last year, and I'll start off by stating that the commission held its first meeting on February 3rd and met one more time on March 2nd before Governor Sisolak made a declaration of emergency in the state of Nevada to address, contain, and mitigate the effects of COVID-19. So several meetings were postponed as the commission followed his directives and guidelines for hosting public meetings. On May 19th, he requested for the commission to prioritize its work to best serve Nevada in this time of state and national emergency, specifically asking for assistance with recommendations around the long-term recovery for our state. On June 9th, the commission held its first virtual meeting and agreed to refocus the commission priorities. Furthermore, on that meeting, the commission also decided to meet every other Monday through August 31st, really with the deadline of September 1 in submitting bill draft requests to this legislature. On June 22nd, the commission met with the intent to start identifying any issues as negatively impacting the quality, accessibility, or affordability of healthcare under the commission's new focus, and they held 4 more meetings before they took action on their recommendations for bill drafts. During those meetings, I just want to briefly highlight some of the topics in which were discussed amongst the commission, including discussing transparency measures to sustaining available healthcare options, addressing affordability for vulnerable populations, improving public health and coordination efforts, improving data collection, analysis for evidence-based policymaking and planning, and also discussed health workforce development as well as telehealth, which is a part of one of the commission's bill draft requests. On August 31st, the commission voted to request 2 pieces of legislation to address access and affordability of healthcare, and I will briefly touch upon that in our next slide. But what I'd like to highlight is following all of the commission's work and on that led up to August 31st, what we decided to do after that meeting, I sat down with our chair and we decided to kind of take a moment to pause, reflect, and solicit the commission for feedback for their remaining work for the rest of the year. So we went through an exercise of getting their feedback for topics of recommendations, other requests for meetings, and we went through this activity of developing a priority list of topics for the commission to rank. And on November 9th, the commission met again and discussed the summary of the priority indication worksheet. And through that exercise, the commission identified 4 priority topic areas, which remain the current focus of the commission and their focus for their ongoing work plan. So if I can, I just want to highlight their current priorities, which are in no particular order, but the first one being a continued review and examination of the cost of healthcare and the primary factors impacting those costs. 2, reviewing healthcare workforce issues in Nevada and considering recommendations to improve access and delivery of healthcare. 3, reviewing the effects of any changes to Medicaid, including the cost and availability of healthcare and health insurance in the state. And the 4th priority is reviewing the role of the PPC and considering how to improve coordination and collaboration efforts. I'm very proud of the work that this commission has done so far, especially given some of the certain dynamics that we had and inability to meet in person. But nonetheless, we were able to host 11 public meetings in the middle of a pandemic, which prior to the pandemic, I didn't even really know how to use Zoom, let alone how to do it in compliance with open meeting law. So it's been a lot, but I think I remain really optimistic at the work that we're doing for the betterment of Nevada patients, and I continue to look forward to member engagement and continued discussions of their priorities. Our next meeting is scheduled at this point for March 15th. So if I can, I'm just going to touch briefly upon our proposed legislation. As Chair Wynn indicated, both of the patient protection bills will be heard in Senate first, and I hope to be speaking to this committee relatively soon to have a deeper discussion on their proposed legislation. Senate Bill 5 is a measure that relates to increasing access for telehealth services and really also focuses on the equitable access. Senate Bill 40 is a transparency measure aimed at enhancing patients' health experience and improving outcomes by implementing measures that help understand data trends. And with that, I will pause and answer any questions that you have or any of your members have about the commission.
I think Vice Chair Peters has a question, so I will start with her.
Thank you, Chair. Yeah, my question just has to do with the scope of efforts related to the variety of insurance that's offered in the state of Nevada. So we have a couple of different models, including Medicaid and PEB at the state level, and then we have our group policies and other policies. And can you just give us a brief description of how the Patient Protection Commission reviews those, whether it's comparing them together or if there's a process yet to do that? Yeah, that's where I'll start.
Great, thank you so much for your question, Assemblywoman Peterson, through you, Chair Wynn, through you to Assemblywoman Peterson, Sarah Shulhagian for the record. What I can tell you is that there isn't any established procedure in having that discussion take place in front of the commission. I know that there has been some limited discussions around the topic of various insurance options. Most notably, I think one commissioner really attempted to have a deeper discussion around public options and healthcare reform within the commission, and that was included in a range of options for the commission to consider as a top priority. What has been established right now with an ongoing work plan is building our agendas around presentations or a deliberation from commission members focused in those 4 top priority areas. And I I believe that topic fits under the second one in which I mentioned, which is the Commission's desire to review the effect of any changes to Medicaid, including the cost and availability of healthcare and health insurance in this state. And so I consistently solicit feedback from the commissioners to recommend presentations or provide information that I can share with the Commission for their deliberation and discussion at the meetings, as well as requests for presentations. And so I foresee that being discussed at the Commission specifically, but only at the request of Commission members who want to take that up for discussion at any of our agenda items.
And for the future, feel free to go directly to the assembly person. You don't have to go through the chair. So,
thank you.
Vice Chair Peters, do you have any follow-up?
No, I appreciate that context. I know that we have quite the kind of scene of insurance to grapple with, and the variety of alternatives people have access to. And I, long term would love to see the Commission really kind of drive into what does equity look like in the context of the variety we have, and how much of what the state's responsible for helps to balance that equity or increase that equity, so that we're ensuring all people have access to the coverage that they need. And we have, in my situation alone, I've got a family of 5 on a single income with a veteran husband who has VA benefits. So we have a really kind of unique position, although it's not, I don't think it's not as unique as it feels in my world. But it's not the same as a single person who works for the state or for one of our school districts, for instance, or for a retiree who doesn't meet the Medicare threshold. So I think that that's something I would really love to see the PPC look into, and look forward to the future work in that area.
Yeah. Thank you, Assemblywoman Peterson. I wholeheartedly agree with you. I don't think that your experience is unique to the patients in Nevada, and I think that the Commission would be enthusiastic to hear recommendations from you as to how you think we could look into that and be useful and to provide recommendations to you. So if you are agreeable, I'd be happy to set up a meeting with you following this meeting and see if we can take a deeper dive into putting that a part of our future agendas.
Absolutely, please do. Thank you.
Thank you.
Do we have any other questions from other committee members? I have a question. I know that one of the bills, I think it's Senate Bill 5, focuses on the telehealth. Can you talk a little bit about some of the discussions that went into that? I know our rural members are familiar with that, as we've had some provisions in place that allow for better access in that, but what kind of discussions went around that?
So yes, thank you. Sarah Shulhagian for the record. I can tell you that the Commission's intent around that proposal was really aimed at increasing access to telehealth for all the patients. I think one of the things, when you look at the long-term recovery of COVID-19, we have seen data and we've seen a lot of examples of patients utilizing telehealth to access service. And there have been several waivers that have been granted at the federal level through the declaration of the public health emergency. And so the Commission really wanted to codify some of those waivers into Nevada law to allow for that expanded service to continue. In addition to that, I think the Commission had a lot of discussion around equitable access and some of the vulnerable populations, but recognized that the state budget and economic recovery was also something they wanted to be mindful of. And so even though they had discussions around increased broadband access, that would also help facilitate greater access for some of the vulnerable populations in the rural areas particularly, but knowing that we needed to look at some policies around that didn't have a huge fiscal impact. And so when we talk about inequitable access, one of the provisions in the commission's measure relates to creating a data dashboard that highlights, different telehealth access and wanting to really make sure that we posted that somewhere so the consumer is aware. And so we have some data to start the discussions about informed policy decisions for the future. So recognizing we need to start somewhere, but absent data and knowing, we wanted to just be, or the commission wanted to really utilize what we have now, or what the state has now. And so there's a couple provisions in there that tie that data dashboard into not only the review of the commission, but also the review requiring that data dashboard be reviewed amongst all the regional behavioral health boards in the state. And the intent behind that was to foster collaboration, but also recognizing that the discussion about vulnerable populations and health equity needs to be at the forefront of the discussion when you're talking about future policy recommendations.
Thank you. Do we have any other questions? I'm kind of looking at the gallery view here. If you can wave if you have anything. No? Well, thank you for your presentation this afternoon. I know we will see much more of you in the future as some of these bills come forward and come over to our house. So thank you so much. And I would encourage all of our members, most of those PPC meetings are online, so you can go back and review some of their meetings. They were very prolific, especially during a time of a health pandemic. I think it was greatly needed for those conversations to take place. So I appreciate the fact that they were able to have 11 meetings during that time. So that is a feat in and of itself. So thank you so much. So with that, I will move on to our next agenda item, which is the hearing on Assembly Bill 16, and I will open that hearing. This is a bill that relates to provisions on the issuance of copies of certificates and records of birth. And at this time, I would welcome, I think I see him on here, Director Charles Daniels, the Director of the Department of Corrections. Director, will you please introduce yourself and your staff and begin when you are ready?
Good afternoon, Chair Nguyen, Vice Chair Peters, and the Assembly Committee on Health and Human Services. This is Charles Daniels, Director, Nevada Department of Corrections. We are presenting Assembly Bill 16. So what exactly is AB 16 and why? The Nevada Department of Corrections is requesting the ability to process birth certificates prior to the 90-day post-release time. Assembly Bill 16 incurs no cost. The implementation does not increase or reduce the overall amount of requests. And although the processing timeline is extended prior to the immediate 90 days post-release, the extension will not have any impact on our stakeholders. To discuss this further, I will turn this over to Deputy Director Harold Wickham, who is in our Northern office. Deputy Director Wickham.
All right. For the record, good afternoon, Chair Nguyen, distinguished committee. Harold Wickham, Department of Corrections. And we've collaborated this concern with the state vital records folks, and then in accordance with the NRS 440.175, a personal governmental organization which issues certificates or official copies pursuant to the paragraph of subsection 2 shall not charge a fee for issuing the certified copy of a certificate of birth. And then 2, a person who submits documentation from the Department of Corrections verifying that a person was released from prison within the immediate 90 days. And frankly, this just limits our ability to provide the offenders upon release with necessary documents to be productive citizens in our communities. And then due to the fact that oftentimes offenders receive merit credits for courses they're taking, school, vocational skills, or whatever it may be, or an early release, our time is shortened even shorter. So we have to find a way to provide these documents sooner So we'd like to do it upon intake when they come in. We do the assessments, find out their needs assessment, and then we can get the documents started. Because even within our facilities, the offenders have to have these documents just to get a job within the facility if they're working for our prison industries or anything like that. So again, why do we need to change? It basically just provides a more comprehensive continuum of care when the offenders leave us. Because formerly incarcerated persons, just like any citizens in our communities, need two forms of ID to obtain housing, health care, education, employment.
Mr. Wickham?
Ma'am?
I'm sorry to interrupt you. Is it possible for you to speak up just a little bit louder? It's coming across pretty quiet on our end.
Okay, I apologize for that.
No, I'm sorry.
No, it's quite all right. I'm getting used to virtual technologies as well. Is that better?
It's a little bit better. Feel
Okay.
free to use your outdoor voice.
Yeah, I'm going to use my outdoor voice. So again, why do we need this? It's basically because we need to provide a better continuum of care for the offenders when they leave the facilities. We need to provide them, just like with any other citizen in the community, you have to have two forms of ID to accomplish just about anything, such as housing, health care, education, employment, vocational training, or even a driver's license. They need these vital documents. And unfortunately, if they don't have these documents within that very first days of being released, that's when we see problems, when the offenders can't get the services, the support they need. That's when they tend to revert back to old models and mentalities and ultimately return to our facilities. And our job is to help to reduce the recidivism, reduce victimization in the community, and provide a better continuum of care for Nevadans. So I just want to say thank you again. Oh, also, I got communication from the Washoe County Public Defender's Office, and they are in support of this, and they asked me to tell you that, but they weren't able to testify today due to conflicting schedules. But I thank you, and I'm open for any questions you may have, ma'am.
Do I have any questions out there?
You were muted, Chair Wynn. May I proceed?
Yeah, sorry about that. Look, I give my own instructions and I don't follow them. Go ahead with your question.
It's been a day. Good afternoon, everyone, and thank you so much for the explanation for this bill. When you say you are going to process this vital statistic, you are going to go through the process of acquiring the information and reaching out to their the vital statistics places. Like, I'm from California, so I'd have to go to Martinez County to get that document for them. Are you recreating something? How can you explain the process, please?
Okay. For the record, Harold Wickham, Department of Corrections. Again, I hope I'm speaking loud enough. We don't anticipate changing the process. We just want to move it further forward so that we can get the documents from Vital Records sooner rather than later. That way we have them in our hands or in the offender's hands upon release.
Elizabeth Dixon Coleman, Statewide Reentry Administrator for Nevada Department of Corrections. To answer your question, Assemblywoman, the process in which we obtain the birth certificates for each of the inmates who are incarcerated, we utilize the state systems for records of birth. So we print out the applications for each state, county, et cetera, whichever is applicable to what they're applying for, including the state of Nevada. And then send them out to the state vital records department of each of those individual states. And so the process then, if we begin at an intake, which we have been doing over the past year, then is to get those birth certificates back in a timely fashion. What we found is most of the states return those birth certificates quicker and sooner to us rather than having a delay as our Nevada Vital Records Department has had waiting for the post-release. Because though we've been working and collaborating very closely with our other state agencies, we do have to do a lot of calling back and forth depending on when their release dates change, if they're involved in programming, et cetera. So we're not doing anything, we're not recreating a process. We're actually utilizing the federal statute process that's in place for retrieval of birth certificate documentation.
Thank you for that information.
Can I follow up with that? We've had several people that ask, what is post-release?
The Department of Corrections, for the record again, post-release is once they have left the Department of Corrections facility. So what we're saying is the way that NRS bill was actually put is that up to 90 days after they are released to home, to the streets, to parole and probation, or however they are back into our community, there's an option to get the birth certificate to them. What we have found in the Nevada Department of Corrections is this needs to be done pre-release. As Deputy Director Wickham has pre-stated, they have the opportunity to obtain jobs inside. They do need to do an I-9 and all those things in accordance to being hired for that, and they need the birth certificate component for that. But also we found that when the offenders are re-entering our community, the more that they have in their possessions to gain any services or anything that will reconnect them to the community, the better to have it when they immediately walk out of the gate and not give them that window. And what we found is on the average federal statistic is within 48 hours, if they don't have housing, wraparound services for obtaining a job, and continuum of care services, in most cases they go back to reoffending because they don't have any of that care.
Thank you. And I think we have a question from Assemblywoman Titus next.
Thank you, Madam Chair. I appreciate that. And thank you for bringing this bill forward. But from all these questions, I'd like to kind of circle back to the actual bill itself. And I just need clarification. The only thing this bill does is under section 1, number 3A2, adds the words is imprisoned. Because currently the statute says we don't charge a fee for somebody who was just released on parole or someone who is homeless. Is that not how I'm reading this? That's basically we're adding those imprisoned because everything else in the statute remains the same. Is that correct?
Thank you, Assemblywoman Titus. This is Elizabeth Dixon Coleman again, Nevada Department of Corrections for the record. You are correct. In reviewing NRS 44175 under subsection 3, the change in the wording is taking away the word post-release, and it incurs no extra fee now. You are correct.
So along that same line, though, as the Assemblywoman Summers Armstrong asked, this only stops Nevada from charging a fee. It doesn't stop if you were born, as many of our people in Nevada are, in another state. It doesn't stop the state of California. Do they charge a fee? And if they do, who pays that fee? This only can make Nevada not charged, correct?
Correct. Elizabeth Dixon Coleman, to answer your question, Assemblywoman, the Nevada Department of Corrections, yes, this is only actually updating to say that the timeline has changed. Nevada currently does not charge that fee for our incarcerated people. Should they want their birth certificate as the law stands today, prior to that 90 days post-release, our inmates do have the option of personally and having their family members or themselves, if they have money, to pay for that ahead of time if they want to do that. And some of our actual residents have chosen to do that. But it doesn't prevent the other states from charging. The other states still do charge and charge those fees accordingly.
Correct. And so if I might follow up on that, Madam Chair, so just along that same line, nothing currently stops an inmate from applying at any time, or a family member, as you mentioned. What this does is just, as we would suspect, they may not be able to afford it. I think having the ID is critical. Like I said, I'm aptly supportive of this. So this doesn't really prevent anybody, the right person, obviously family member with permission or the inmate themselves, from applying for that document at any time, correct?
Correct. Assemblywoman, this is Elizabeth Dixon Coleman, for the record again, Nevada Department of Corrections. They can apply at any time to pay for that birth certificate. It does not prevent them from that action.
Great. And then finally, you talk about IDs, and I think absolutely critical when they get out, if they have to apply for a job or a home or et cetera, they need ID. I'm wondering about like their Medicaid enrollment, health insurance. Does this have any implication on access to care?
Yes.
Yeah,
Elizabeth Dixon Coleman, to answer your question, Assemblywoman again. Yes, it does. The more ID that they have, whether it be a birth certificate, social security card to apply for Medicaid, for health services, for housing, that continuum of care for those wraparound services is NDOC's mission and has been over the past 3 years to hopefully connect returning citizens with those documents. So there is no delay or there is no break in care for that. And as we are with SB 236 going forward to apply for Medicaid services, et cetera, we do utilize those documents to make sure that those services can be connected for each of the residents who are reentering, as well as making sure that working for Medicaid specifically, since you did ask, Assemblywoman, that they are actually, those benefits are reconstituted before release so that they can actually be initiated immediately upon release with no break in service.
Great, and thank you. And I appreciate the Department of Corrections being advocates for those that are incarcerated from day one of their incarceration, because it's critical that we understand you have to anticipate their release from the moment they're incarcerated. How are you going to help these folks moving forward? So thank you for all you're doing, and thank you for the questions, Madam Chair.
I think we have a follow-up question here, or another question from Assemblywoman Summers Armstrong.
Thank you so much. Wonderful information, Ms. Dixon Coleman. But just to get some fine clarification, let's say we have someone who is incarcerated and they don't have family and they don't have money on the books, but they still are coming close to their 90 days and they need these vital statistics documents, and they're from Minnesota. What do you do then if they don't have resources?
So the applications are processed, and then should they incur any funds that are put onto their incarceration funding sources, their bank, their books, actually, excuse me for using the slang, but with that, then they would be charged back for that documentation upon release or what they need. But each person that is incarcerated is provided with that documentation.
Madam Chair, if I may follow up.
Go ahead.
Thank you. So, so is there a sum of money that is given at release that this can be charged back to so that the person can leave with the documents that they need? And if that is so, does that leave them in a vulnerable position when they're leaving if the documents cost a certain amount of money and it's deducted from that fund that they are receiving as they're walking out the door?
Assemblywoman Elizabeth Dixon Coleman, to answer your question specifically, yes, it would be deducted from the funds in which they are receiving upon release. And depending on what the individual states charge, they range in average from anywhere from $15 to about $43 per birth certificate, depending on the state in which you're asking for. It could incur, I guess, a deficit or a burden upon the reentering citizen. Yes, you are correct.
Madam Chair, if I may.
Go ahead.
Thank you so much. So the reason I'm asking this is because I'm in Assembly District 6, and I have worked and had numerous conversations with those who are helping the homeless in my district, the Las Vegas Rescue Mission. Many of the services for the homeless are in Assembly District 6. And what ends up happening is that the municipalities then end up incurring the cost of helping people who cannot afford to have this deducted from their bank when you all release them. And has there been any type of discussion with the municipalities about this issue so that there's a way to set up a reserve so that we're not letting people out who ask for this information, one, without those documents, and two, having the amount deducted from their bank to the point where they are leaving incarceration desperate because they've had almost $100 deducted from the small amount that they're leaving out with. This is a real concern. We don't want to see recidivism in our community. We don't want people not asking for these documents because they know when they come out, they're only going to have $150 and they've got to, you know, have a room for a night or they've got to get some food. But we also don't want to leave our local municipalities who are also strained holding the complete bag to make sure that people are not, you know, homeless on our streets. We have rules in Las Vegas where people can't sleep on the street. It just becomes really cyclical if there's not a holistic approach where you all are in communication with the municipalities to help come up with a solution.
Okay.
Chris Franklin, management analyst for Nevada Department of Corrections. Thank you for the question. Right now, we have not reached out to the municipalities individually. As you may know, the Nevada Department of Corrections participates with many of our stakeholders in our reentry task force out in the community. And they are the first ones to admit that identification is their biggest problem, to be able to provide the services to those that are in need. Now, as we previously stated, this process for us starts at intake. Okay? Most of the offenders coming in don't have any money in their inmate accounts when they come in from county. So the inmate welfare fund, or the inmate welfare account, excuse me, here fronts that money to them so that they can get their birth certificate and we can get it into their files for later use and upon release. If upon release they don't have any funds, then that dollar amount that we've been holding gets written off. So we're doing everything within our power to try and provide them with the identification they need, their birth certificate that they need, but just as out in the community, maybe their family member wants to get it to them sooner, or there's a cost involved with getting the birth certificate. Sometimes that cost gets transferred over to the person who needs that piece of documentation.
Elizabeth Dixon Coleman, for the record, Nevada Department of Corrections, Assemblywoman. To piggyback off of that, we also have a continuum of care with many of our MCOs, with our managed care organizations and community partners, that should extra subsidies need to be utilized for obtaining either documentation, wraparound services, housing, etc. We try to make them connected to some of those MCOs and other state supported agencies that are community partners to assist with any deficit that they should have. So if they come out with less money for housing, we try and connect them with those components. If there's a fee for, or they need connectivity for medical resources, we work with our managed care organizations to help ensure that they're not left without those resources. Just so you understand that there is some community resources to support the component of coming out on a deficit.
Madam Chair, I'm sorry, this is very sensitive to me. I apologize, and I appreciate your indulgence.
Go ahead.
I just think that it's important that we understand and that we recognize the reality that people, everyone who is incarcerated, doesn't have family who have extra resources to put money on people's books. And if there are fees that are being taken out of their bank as the time goes during their incarceration and they're left with very little, are we setting up a system that is helping that person fail? And I'm concerned about it because it directly impacts my community. We have 15% unemployment in assembly, in parts of a large swath of Assembly District 6. We have the most homeless population in this Clark County is centered in Assembly District 6. And I want there to be solutions to help people succeed, not to set them up for failure. And it's hard for me to believe that it is a burden, a huge financial burden, for us to make sure at the very least that we give people IDs so that they can get these services as they're leaving. And for those who don't have families who can just put money on their books, if people have a hard time paying for bail, where are they going to get money to put on people's books? I just think it's connected financially. And I think we have to be cognizant of that. We're not setting people up for failure. I don't want to see recidivism because people are desperate. Desperation is what makes people do desperate things. So thank you for listening.
Thank you for that. I have a couple of questions. I appreciate that you guys are bringing this bill, and I appreciate your clarification that when people don't have the funds, that there are ones that you are just writing off if they don't have the funds to be able to cover it, because I think that's a smart thing to do. So I'm glad to hear that you guys have said that. I know that we have had a huge problem with people that have been granted parole and they are unable to obtain like services, housing or other wraparound services. And so they have been granted parole, but they're still incarcerated. Do you anticipate getting this identification earlier on will help alleviate some of those problems?
Elizabeth Dixon Coleman, for the record, Madam Chair. It is, sorry, I lost my train of thought. I apologize. So as they are exiting, we are working collaboratively with parole and probation and other state agencies so that this is not a preventative measure, and that having these pieces of documentation in ahead of time and obtaining them sooner than later will enable them that should they need those wraparound services that are not extended, as Assemblywoman Armstrong had said, by family members, etc., that it gives them time should they be going forward with parole and probation, or should they be exiting prison without those family supports, that they have those documents ahead of time so that they can get the services that they need. And it not being necessarily a preventative action to not release them because they don't have a birth certificate specifically.
And I think I saw Mr. Wickham kind of waving his hand. Do you have a response to that as well?
Thank you, Madam Chair. For the record, Harold Wickham. No, I think Elizabeth covered it very well. I just want to say also that we do have the Inmate Welfare Fund that also provides for birth certificates as needed. But the reality is, as a Department of Corrections, our mission has changed so dramatically. Our goal is to put the offenders out on the streets as productive citizens. So we're going to do everything we can, and we want to do it as soon as we can, get the offenders their identification, get them the necessary documents, training, and even vocational skills to return to the community successful, because that is our ultimate goal, is to protect the community. Thank you.
Thank you. Do we have any other further questions? One second here. I have some messages coming in. Okay, I think that is all. So at this time, I will hear testimony in support, opposition, and neutral on AB 16. I know that there were several people. I think Mr. Wickham had indicated that the Public Defender's Office had indicated their support. I believe some people have submitted written testimony on this as well. So I'd encourage our members to go and take a look at that as well on Nellis. And at this time, Broadcast Services, can you see if we have any testimony in support of AB 16?
Yes, Chair. To testify in support of AB 16, please press star 9 now to take your place in the queue. Would the caller with the last 3 digits, 499, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello, my name is Jody Hocking. I am both part of an impacted family. My loved one is incarcerated at Southern Desert, and I also am the founder of Return Strong Families United for Justice. I appreciate your time today. I really wanted to come and share on a personal level my support for AB 16 and providing birth certificates for incarcerated people prior to their release from prison. My partner was released in October of 2018 after 19 years of incarceration. He did get a voucher to waive the fees for his birth certificate, which was a help, but it really disregarded many of the barriers to transitioning into society. Prior to incarceration, he didn't live a life that necessarily followed the rules that many of us follow. So he never had a copy of his birth certificate or a social security card. He never had a driver's license. But when he was released, he had all the best intentions to live what he called a square life, family and home and working and staying out of the way and out of trouble, a life that followed the rules. But unfortunately, every corner that we turned created more problems. It took us 4 months to actually get his birth certificate because the ID that was given to him by the prison was under an alias, which he had used when he was arrested. It wasn't his true name, so getting a birth certificate became a barrier to identification, which created a dilemma in finding work and getting health insurance to deal with the PTSD that he has, attending school. He was accepted into a union apprenticeship, but then couldn't provide the correct identification because he didn't have a birth certificate. The crazy thing is he spent a year asking a caseworker to help him address the problem without being able to ever get that resolved before he was released. Honestly, the frustration and anger created a cycle of depression and hopelessness that is hard to really describe how deeply it impacted him. So deeply that we started to see him slip away. He would always say that he was lost, but it was devastating to him to want so desperately to do the right thing by all of us and not be able to do it from no fault of his own. Now, as Mr. Wickham and Director Daniels have said, and so many times that this happens, he's back in prison now on a violation. Can I completely blame the difficulty in getting a birth certificate as the only reason that happened? No, it's not that simple. But I do frequently wonder if the system had set him up for success, would the result be different? And I definitely think that it could have been. If we want to provide people a chance at getting it right, we have to set them up for success outside of prison. A birth certificate and an identification in their true name would be the bare minimum that they could expect. I'm here today in support of AB 16, and I did just want to make an additional comment. While you guys were talking and asking questions, I did some research, and there are a ton of states that actually have waivers. Even if you live out of state, you can provide a waiver for your birth certificate if you're incarcerated. So I do agree that we need to think about people who are from states that are not from Nevada. but it looks like there's some potential solutions to that problem if we work together on them. Thank you for your time.
Thank you. Broadcast Services, do we have any other people in support?
Yes. Would the caller with the last 3 digits, 725, please slowly state and spell your name for the record? You have 2 minutes and may begin.
Hello, and thank you, Chair Wynn. This is Nick Shepak, Nickshepak, the Policy and Program Associate with the ACLU of Nevada. I'm very happy to both be in the Assembly Judiciary and support of a NDOC bill, 2 things I don't get to do every day. Leaving prison and starting life is hard for even the most well-supported formerly incarcerated individual. Obtaining important documents such as license, birth certificate, social security cards can be confusing and a daunting task for the average person. Imagine how hard it is for someone who has spent 20 years or more incarcerated. The world is different than they remember it, and simple daily tasks such as shopping for food can be overwhelming. We are very happy that NDOC has decided to try to make this simple and meaningful change. If we truly want a system that works to ensure successful reentry, we must provide incarcerated people with the tools to succeed. This includes important personal documents. These documents need to be in the possession of their rightful owner upon release. We urge the Nevada Department of Corrections to work with us and families on their legislation this session so that we may continue to show up in support. While this bill needs no amendment, we believe that we can find common ground on most of their proposed legislation. We urge this committee to pass this simple and meaningful legislation and continue to work on any effort that will make re-entry into society easier for our soon-to-be neighbors. Thank you all very much.
We could go to our next caller in support.
Would the caller with the last 3 digits, 080, please slowly state and spell your name for the record? You have 2 minutes and may begin.
Hi, Jim Hoffman, JIMHOFFMAN, for Nevada Attorneys for Criminal Justice. We think this is a good bill. We support this for the reasons that everyone has already said. And specifically in response to Assemblywoman Summers Armstrong's concerns, we would note there's another step here that could be taken. This bill just applies to NDOC. It applies to people who are in prison. But we know that a lot of people who are incarcerated for misdemeanors in the county jails also have this kind of problem. And there's nothing in the bill that helps them. There's nothing in the existing law that helps them with this. So we think that would be one opportunity to strengthen it. But as previously stated, even without amendment, this is a good bill and we support it. Thank you.
Chair, we have no more callers in support at this time.
And I'll go to opposition. Do we have any callers in opposition?
To testify in opposition of AB 16, please press star 9 now to take your place in the queue. Chair, it does not appear that we have any callers in opposition at this time.
I believe I know the answer to this, but do we have any callers in neutral?
To testify in neutral on AB 16, please press star 9 now to take your place in the queue. Chair, there is nobody in neutral at this time.
Thank you. At this time, I will ask the sponsors if you have any closing remarks or if you'd like to waive those remarks.
Chairman Nguyen and Vice Chair Peters and the rest of the Assembly Committee on Health and Human Services. I would just like to thank each of you for allowing us to present this bill. And we think this is a win-win for everyone. And we look forward to providing legislation of this nature to be presented before you, because we do genuinely believe this is impactful and it's meaningful, and there's no downside to this. So once again, thank each and every one of you for your time, as well as your questions and concerns, and that also includes the public comment. Thank you.
Thank you. And with that, I will close the hearing on AB 16. Let's see, at this time, I will begin public comment. As a reminder, to provide public comment, please register online at the legislative website. Please clearly state your name and spell your name for the record, and please limit your comment to 2 minutes. Broadcast services, do we have anyone in the queue for public comment?
We do have people in the queue. Let me check if they'd like to speak. If you would like to speak in public comment, please press *9 now to take your place in the queue. With the caller with the last 3 digits, 321, please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 321, please press *6 now.
Good afternoon. My name is Yarleni Roa-Dugan, Y-A-R-L-E-N-Y, ROA-DUGAN. Thank you, Chair Wen and committee members, for your time and for the opportunity to speak. I am a registered nurse in Las Vegas, and for the record, I also would like to disclose that I am a member of the Patient Protection Commission and an executive board member of the Service Employees International Union, Local 1107. But at this time, I would like to testify on my personal opinion. So I'm here today because this committee heard an overview of the Patient Protection Commission from Sarah Chohagan, the executive director. Therefore, I feel compelled to speak from my personal experience sitting in the commission as one of the 2 patient advocates. I have experienced that having only 2 patient advocates does not sufficiently represent the Nevada patients' views, opinions, and concerns. Also, there is a lack of patient participation during meetings, and the commission hears mostly from healthcare organizations. If given the opportunity, I would encourage this body to consider my testimony and increase patient advocates in the commission. Thank you for hearing my testimony. I welcome the opportunity to further discuss this with you anytime or answer any questions that you may have.
Thank you. Do we have anyone else in public comment?
Chair, the public line is open and working, but there are no more callers at this time.
Okay, wonderful. Are there any comments from the members before we adjourn? Seeing none, this concludes our meeting for today, and we will not have another meeting until next Monday, February 22nd at 1:30 p.m. I think I already notified most of the members of this committee that we would be not meeting on Friday. And so at this time, meeting is adjourned.
Thank you, Madam Chair.
Thank you.
Thanks, Chair.